JIS Orthopedics was established in 1972. My founding partner, Dr. Mallory, did the first hip replacement in Ohio in the early 1970s.
It started as a joint replacement practice, doing tens of thousands of joint replacements, being the preeminent joint replacement practice in the nation for quite some time, about 30 years, and now has grown to spine surgery, upper extremity surgery, sports surgery.
Being one of the first practices to even do a hip replacement in the Midwest, starting in 1972 with Dr. Mallory, to our growth as an arthroplasty practice and how we have evolved over the past 15 years to stay relevant and to stay growing. I think that's what makes us quite special.
At our facility at JIS Orthopedics in New Albany, we have physical therapy, we have durable medical equipment, which means braces and things of that sort. We have our own x-ray capabilities, we have an MRI right across the way. And then in-office procedures we can provide, steroid injections, gel injections, newer injections like stem cells and platelet-rich plasma. We can do all that. And then our surgery center, we have a few. One is located right above our office. Really, it's one-stop shopping for patients as far as convenience. When they come see us and they do end up having surgery, when they're going around getting all the things they need, it's all right there, so they're not making trips to different locations.
Take, for example, somebody who has knee arthritis, right? We can see that patient, and maybe it's not having enough of an effect on their life for them to undergo surgery right then. That doesn't mean that they can't feel better, and we offer many things to help them feel better, to help them live how they want to.
There's a litany of things you can do to make a patient better. They can do physical therapy, they can take oral medications, you can have injections. You don't want to think, yes, we're surgeons, but we also are doctors and we're caregivers, and you just want to do the least invasive thing for a patient that makes them feel better and live their life the way they want to live it.
Everyone at JIS Orthopedics is fellowship trained, and that means they've taken an extra year after training to specialize in their area of expertise. And that has been shown throughout multiple research projects that fellowship training, specialization, and experience are the things that lead to the best outcomes, the lowest complication rate, and the fastest recovery.
So to go to a subspecialist in orthopedics is advantageous for the patient because it's not somebody who does 25 total knees a year, it's somebody who's doing hundreds.
Back in 2011, 2012, we came up with the idea of developing an outpatient center specifically dedicated to outpatient joint replacement. And we started doing these outpatients. What we found was that the patients were happier. They were more mobile, they were more independent, and they were reaching their therapy goals even faster.
We can do full hip replacements, full knee replacements, partial knee replacements. All of that can be done in a surgery center. The satisfaction is 98% across the board for our outpatients. 90% of my patients are going home within 4 to 5 hours of surgery. And so we are doing your surgery, we're getting you up, we're getting you moving, getting back to life again.
Emergency rooms are for just that, emergencies. And if it's not an emergency, if it's a trauma that's not an emergency, if it's an injury, and even if it's just an illness, sitting in an emergency room, you're last in line if it's not an emergency. We want you to be first in line, and we can provide that. We can have you be first in line in our practices here within Ortho Alliance and within Central Ohio.